us this evening to watch the session that Helen Clark participated in at our parliamentary symposium last week. I began by asking her about the Global Commission on Drug Policy, which she's the chairperson of.
It was set up 10 years ago. It was set up by the initiative of a group of former Latin American presidents who saw the incredible damage that the so-called war on drugs mandated by the UN drug conventions was doing to their society. The increase in crime and violence, of course, the over-incarceration, something we're rather familiar with in New Zealand, and they wanted change, and they sought support initially from the Open Society Foundations, funded and led by George Soros, a very bold foundation which is prepared to back reform in policy and law where others may fear to tread. And the history of the last 10 years has been of the Commission working to lift the taboo on even discussing the kinds of issues that are raised now about ending prohibition, ending the war on drugs. I think we've lifted the taboo. It's possible now to have at least conversations about these things, even though we'd like to see more movement. And at the end of this decade, we're looking back on actually quite a lot of movement, not just in the debate, but a number of pioneering countries stepping out front and showing the rest what could be done.
Yeah, it's exciting, isn't it? Look, I'm also just interested, before we get going into that, around what's motivated you to get so involved in this issue?
So fundamentally, I think it's a human rights issue. I believe that people who use drugs are singled out for unfair, irrational, and disproportionate treatment. That includes in our own country with the continuing rate of incarceration of people who use and possess. Of course, if we go out to the extremes on that, we see the death penalty exercised against people who use and possess drugs. We see the extrajudicial executions pretty much mandated from the top in the Philippines. And we see absolutely barbaric treatments amounting to torture of people convicted on these so-called drug offences in around 26 countries around the world, including Singapore, where people are caned to the point where they can lose control permanently of their bodily functions and lead really not just a very miserable life behind bars for so many years, but actually physically and mentally deeply affected by what has happened to them. This is wrong. So once I had the time beyond the full-time positions that I had to choose which causes I would put my effort into, this was one of them.
And we're very grateful for it. I can feel the room just so grateful for you sharing that. So just thinking a little bit more about that, because I think we have our own experience of the war on drugs here in Aotearoa, and that context of what's happening abroad and what has happened in terms of that so-called war on drugs globally is just an important reflection for us. So I'm wondering if you can tell us a little bit more about perhaps, say, Mexico or the Philippines, and what the real consequence of that sort of war on drugs approach has meant for people in those countries or in any others that you want to reference.
So in the Philippines, when the current president came to power, he basically licensed, in any other words, a full-scale attack on those who used drugs, were in possession, and also the small fry people who dealt with them, particularly in the informal neighbourhoods where life was considered cheap. Frankly, life should never be considered cheap, and so the rate of death and extrajudicial execution soared. I might say. Many others are on the front lines of that in the Philippines and other countries too. If we look at what happens to human rights defenders, labour rights advocates, environmental advocates, people who advocate for a better country can find themselves on the wrong end of an assassin's gun. So that's a very miserable situation. Now, let's take, though, the example of Mexico. Mexico did not used to be the homicide capital of the world. I recall in earlier years when I was a younger politician, Peter and I travelled extensively privately in Mexico, and we loved it. I look now at places that we went to, which are absolutely no-go areas because of the gang warfare and the violence associated with it. And this really escalated under two presidencies ago when the president brought in wholesale to the, quote, war on drugs, militarised the response, the stakes went up. The result is, of course, Mexico going to pretty much the top of the league of homicides in the world per capita, many disappearances, people never accounted for again, many people fleeing from their homes because of the dangerousness of the neighbourhoods. It's been a spiral into a very bad place for Mexico, and it's hard to climb back out of it once this has happened. Mm-hmm.
The human cost is extreme, and as it takes us time to move towards a change, more lives are impacted. You've been with the Commission since 2017, and you mentioned this a little earlier, that you're seeing some changes, and I'm just wondering if you could tell us a little bit about any changes that you are seeing. As you know, we get the sense that maybe is there a change in mood on the ground, developments in terms of law or practice that you might want to highlight for us?
Well, actually, quite a number of exciting developments, and if we started with Mexico, there have been developments on cannabis law driven by the highest court in Mexico. And there is in Mexico, under their constitution, a provision which roughly says that where these high courts rule in the same direction 5 times, then the Congress is bound to legislate to fix the fundamental issue that the court is raising. And in the case of Mexico, the courts have ruled the 5 times or more that the prohibition on the use of cannabis amounted to an infringement of the constitutional right of Mexicans to, quote, develop their personality. So that led to the law then, going to Congress to be revisited. Now, like all these things, there's hiccups along the way, and I understand that it's currently a bit stuck in their Senate with debate postponed. But nonetheless, it's come up in Mexico as a judiciary-driven change, which is exciting. Now, let's go to Norway, a country we often like to compare ourselves with. And interestingly, while we generally think of the Scandinavian countries as being socially progressive, on drug policy, for the most part, they haven't been. So any movement in Norway is of interest. And in Norway, there is a Conservative-led government, and the Conservative minister eventually saw the light and said, I really would like, to while I'm minister, to be able to change the law around the use of drugs. And he recommended, in effect, decriminalisation of all drugs, which isn't novel. It's been done, obviously, in Portugal all those years ago when the current UN Secretary General was Prime Minister, and in effect done in Switzerland and other places as well. Now, of course, he's run into political trouble. It's only 3 or 4 months or so to the Norwegian parliamentary elections. So the Labour Party has ended up taking a rather political stand on it. And that's a bit stalled as well. But, it's a bit hopeless if we kind of lurch from, I'm putting up this idea, therefore, the other side's going to oppose it just because they're the opposition. And then when they get into power, they try it, and then the others do it. I mean, I really think that the work the Drug Foundation and other advocates of reform in New Zealand are doing to try to lift it out of this political gridlock is incredibly important. These shouldn't be party political issues. They don't belong inherently on left or right or green or whatever. these are human rights and health issues about how we support and deal with issues affecting some of the most marginalised people in our societies. So, jury out on Norway as to whether they'll progress anything before the election, or whether a different government or the same government continuing will have another go. Look, probably most exciting, I think, is the movement in the United States of America. I think people in the audience today will be very familiar with the significant number of states now, more than a majority of states in the United States of America, which has driven the war on drugs internationally. More than half have either legalised or decriminalised cannabis. And the House of Representatives in December last year passed a law on marijuana, which would decriminalise it and expunge convictions. Of course, it has to be passed in the Senate, which hasn't happened yet. But you see how much the movement is. And then the US are in the habit of appointing what they call a drug czar. Well, the current drugs czar, just appointed by the Biden administration, has made really what is quite a remarkable speech for the United States of talking about focusing on the health and inequity issues of the drug law regime in the United States. And there, as in New Zealand and elsewhere, the ethnic disparities are absolutely striking. So it has obviously resonated with the Black Lives Matter hashtag movement, as it resonates here with all of us who don't want to see any group of New Zealanders singled out for unfair and disproportionate treatment.
Oh, that's it's fantastic, isn't it? Those movements that are happening, and I got distracted by what you were saying. But I'm just wondering, because there are a number of countries. It feels like we sort of hear about another country each week that's making some movements towards this more health-based harm reduction approach to drug policy and law and practice. Is it a global philosophical shift? Or is it more a handful of more Western countries that are taking a bit of initiative?
Well, certainly in the Western democracies, which by their nature can be more open to debate, I think we're seeing some more movement. Having said that, I re-emphasise again that there was a virtual taboo on discussing these things, right? The sort of weight of these ridiculous UN conventions, the whole war on drugs approach made it very, very different. But I think the work of so many, and it's not just the Global Commission. The Global Commission couldn't get anywhere advocating at the highest levels of government and the UN system if it wasn't for the incredible movement of civil society advocates across the board at the community and grassroots levels of countries. So it takes many hands to propel this issue forward. But the original impetus for our commission was out of Latin America. And so in Latin America, you've had Uruguay, which has gone all the way on legalization of cannabis. One of our commissioners is the former president of Colombia, actually two former presidents of Colombia commissioners, and Juan Manuel Santos, president before last, and a Nobel Peace Prize laureate. He did act on decriminalisation in the cannabis area. Now, it's ping-ponging around in Colombia because he was succeeded by a harder line president, but it will continue to be an issue with a groundswell, I think, in Colombia, because here's the rub. In societies where the rule of law is weak and corruption is high, and there is social conflict and worse, armed conflict, prohibition of drugs acts to actually fuel those social conflicts and armed conflict and corruption and of course, organised crime. It fuels in our own country and others, but it can have particularly dire consequences to prohibit in societies which don't have the level of rule of law and zero tolerance for corruption that we have.
I'm just going to move on to a couple of specific countries to focus on, Canada and the States probably, but also just Norway, I think, because you mentioned it before. You mentioned before, the latest I heard was that they're currently in negotiations and that there's a vote in their parliament on the 2nd of June. And one of the inspiring things I think about the Norwegian story has been the exercise of civil society leadership, and in fact the leadership of one man in particular who has a lived experience background, right? And he managed to convince the health minister to say, I think most famously, the words, "I was wrong and you were right," at a UN conference. Yeah. I don't know if you have anything to add from your knowledge of Norway.
Yes, as I said, it's kind of got caught up in the pre-election positioning of parties. So Conservative minister, as you say, said, I've seen the light, I've had it wrong all these years, I want change. And then it was sort of tossed to Labour as the obvious place to go for votes for a majority for change. And then there were ructions within the Labour Party. And I think a bit as you're seeing in a number of countries, you can get a divide between those who live in the metropolitan centres and those who live outside in the regional centres. And the party, as I understand, had a debate that fractured a bit along those lines. And it seems to have come up with a proposal for the negotiation that, okay, we don't want the law book thrown at people who have a dependence on drugs, but we want to keep signals in there to dissuade young people from using them. Well, really, this is a bit silly. I mean, I think the reality is that illegality is often part of the lure for young people. My experience in life is, you say to young people, don't do something, they want to do it. That's the nature of youth. So we've got to get a bit smarter than that. So, look, one just hopes that as the debate goes on in Norway, they might come up with something that at least inches forward, which then a future government and parliament might build on. Yes,
they have an election in September, I gather, as well, which will be adding to the situation. Just thinking about Canada, you'll be aware of the massive opioid crisis that's happening in North America, of course, and I understand that they've had scores of thousands of deaths. The traditional response in many countries, including our own, would probably be to therefore crack down on drugs and get tougher on drugs and crime. And I'm just wondering what indeed they are doing, what approach they're taking.
Yes, I mean, we should look to Canada because they are prepared to take a rational approach to these things. About 3 years ago, when I was in Ottawa, I went to visit the Parliamentary Under-Secretary, now Minister, Bill Baird, who was driving the cannabis decriminalisation bill. And Bill had spent his life as a cop. He'd been a very senior cop. He'd been an undercover cop. He'd been, I think, the Commissioner for Police in Toronto. And he said to me, Helen, I know what doesn't work. It's prohibition. I spent my life trying to enforce pointless laws. Very powerful words coming from him. So they moved on cannabis 2.5, almost 3 years ago, October 18. By the way, no blowout in use, contrary to all the ridiculous projections that we heard from opponents in the debate here in New Zealand. But they're now proposing to develop a bill which would basically reduce the criminalisation of all drugs. They're also prepared more to experiment with effective harm reduction than we have been. There are safe consumption rooms, drug consumption rooms in Canada, and need more of them. We don't have any. We need them. For heaven's sake, Sydney's got one, Melbourne's got one. They need more, but at least they've established the precedent. They're more open-minded to the use of wider availability of the anti-overdose drug, Naloxone. And by the way, the World Health Organization advises that anti-overdose drug should be available anywhere where there is a risk of someone witnessing an overdose to be able to administer it. It's not just something that needs to be available in a clinic. So Canada is open to more of these things, and I think a law change now would be very, very positive in enabling them to further improve on the harm reduction measures that they have. So watch that space.
Yeah, so I'm just thinking about the naloxone issue you just raised. It's a one of frustration here in New Zealand. We've been trying to get it properly distributed in anticipation of any potential crisis here. Can you speak a little bit more about the benefits of naloxone or that opioid antidote?
Well, bottom line is that no person who uses drugs should die from an overdose. That's why we need to see this as a human rights and a health issue. People deserve to be safe, whatever the choices that they make. And I'm a very strong advocate of drug consumption rooms. Wouldn't it be great if one of our inner city churches would take the plunge, as happened in the case of Sydney, where the Uniting Church took the lead on this. Drug consumption rooms save lives, just as the pill testing at festivals, which the Drug Foundation and others have been such advocates for, save lives. So similarly with naloxone, it needs to be available to people who may witness an overdose. It may be that your flatmate is someone who uses drugs. You need naloxone on hand. It may be that your child uses drugs. Your child injects drugs. You need naloxone on hand. So, as I say, World Health Organization advice is clear on this. And I think, we really need now a fresh impetus on harm reduction in New Zealand. We haven't had significant initiatives since the needle exchange scheme, the first public one in the world began more than 30 years ago. The pill testing move is now the next really significant move, if you like. The Misuse of Drugs Amendment Act should have been a significant move, but of course leaving police discretion meant that things pretty much carried on as they were, which is most unfortunate, and that needs further amendment. So that there's plenty of things we can do, including on naloxone.
So just a little heads up to some of the people in the room. We've got No Use Stuff who run the drug checking here in New Zealand with our awhi. And we've got here as well the Needle Exchange. And tomorrow we've got Michael Baker speaking, who helped with that setup of the Needle Exchange originally. Just also, I think continuing on with that opioid crisis, the United States. So they have had, I understand, more than 70,000 Americans die from drug-involved overdose. And also we know that we've had the massive criminalisation of Black and Latino Americans over, what is now decades, maybe even a century almost. Yet we've had this change in administration and change of approach. You mentioned a bit about this before. I wonder if you can tell us anything more about what's happening in the States and the hope you might have with the change that's happening there.
Well, I'm hopeful. President Biden has direct family experience, and some of you may have seen, as I've seen, the interviews with his son, Hunter, who has written a book recently about his experiences. Hunter is a professional man. Hunter is a person who uses or used drugs. When Joe Biden was vice president, his son was on the mean streets of Washington, D.C., buying drugs on the corner and, getting himself into really very difficult position with his health. So Joe knows this at first hand. Joe believes no one should die because they use drugs. And Joe believes that people who use drugs shouldn't go to jail. The issue is, will this get really to the top of the political agenda? Can it be driven through the US political system, knowing that the Senate majority hangs on the one vote of the vice president? The drug czar, who is responsible for driving drug policies, is making positive noises. Let's see what happens. But before COVID, and putting to one side, if we can, the huge burden of non-communicable diseases in the United States, the opioid crisis, the deaths from the opioid crisis was the big health issue continually hitting the headlines. And it's still there. COVID hasn't taken it away, and it needs to be dealt with. And they need, really a multi-sectoral, to use the awful jargon, a comprehensive approach to it. They've been too lax with prescribing drugs. They've reached from the law book for the law book when people actually need help with the dependence that's been created on these drugs. They need drug consumption rooms. They need substitution therapy. They need so many things. So there's plenty for that administration to get its teeth into if it can get the bandwidth to do so while it's fighting the terrible situation created by the pandemic.
I've been given the 1 or 2 minute nod now, so just to say that. And in the room, just also to say, Billie Holiday, in the words of the famous Billie Holiday, of course, I need help, not jail time, I think were her words. Look, we have in the room a few of your maybe even former colleagues. I don't know if it's the same time period. I can see Chester Burrow sitting over here. I can see Tamati Coffey at the back. I can see Arana Williams, a bright rising young star from one of my favourite neighbourhoods, Manurewa. And maybe there's some others in the room I've missed. I'm just wondering about any words that you have in terms of trying to encourage movement in Aotearoa. We're obviously, been wanting this change for so long that for some of us it can feel frustrating. I've been told I need to get more patient by my colleagues because it's going to be a long ride. So just asking you what words of hope or suggestions you have for both policymakers, government and ourselves.
Well, firstly, I think we take hope from the fact that Chester is here, coming from being a national MP, prepared to lead on these issues, and Arana and Tamati are here, obviously, to go back and tell others in the caucus what's been happening. We have to build the bridges across parties on this. We have to patiently go through the arguments. I'm not particularly patient anymore either, Sarah, so I empathise, but it is just a question of keeping on with the advocacy. Some things need law change, others need policy change, others need to be sort of growing that space for initiatives, as happened in Sydney with the drug consumption rooms. There are many practical things that can be done. And we just need to keep, raising the issues in a rational way, pointing to the evidence of what works elsewhere. And there's a growing amount of it. We see New Zealand as a progressive country socially. Last year, frankly, was a bit of a blow to that reputation. But we can rebuild it. So let's not give up on that. We have to have hope.
Oh, kia ora. I just want to ask everyone to join in thanking you for making time to be with us today. Thank you. And thank you all for joining us this evening and watching that talk. I can see from the comments that we've had this evening that many of you share our frustration and impatience and would like to see change happen sooner. Thank you for joining us tonight. Next week we will have Professor Nicole Lee speaking on methamphetamine, and we look forward to talking to you again.